Michelle ASMR. Hi, how are you today? Good. My name's Dr. Michelle. It's really lovely to meet you. Today we're just going to be giving you an overall health check. I know you've come in today with a little bit of a sore throat. Yeah, that's not too good, is it? Okay. Just feeling a little bit dizzy as well. Okay. Well, we're just going to do a routine check of you today to see how you're feeling. But I hope you don't mind. Today I have my assistant Angelica with me, and she's just going to be performing some of the tests on you as well. She's kind of training currently in school at the moment, so we'll just be explaining a little bit further in detail everything that I'm going to be doing today, just so that she can make some notes and understand what's going on, and then maybe have a go herself as well. Okay, great. Okay, so first we're just going to be taking the patient's information down. Okay, so could I have your first and last name, please? Thank you. Date of birth. Great. Okay. When was the last time that you had a checkup? Okay. So it has been quite a while. Great. So could you just explain to me what exactly the symptoms are that you've been experiencing? So sore throat. How would you describe it? Just general aching and tenderness, or like a croakiness? Any sort of difficulty swallowing? Kind of hot. Okay, hot. And difficulty swallowing. Okay. So of course we're going to check that out today. And you also said that you've been feeling dizzy. And how often has that been a problem? Has it been, maybe after you've been looking at the computer for a long time? Okay, so just when you're standing up, it's almost like you have a little bit of vertigo, and then it gets better over time. Okay. Have you been drinking enough recently? Great. And going through my memory, I'm pretty certain that you have no pre-existing health conditions, but has anything come to light recently that I need to be made aware of? Possibly any health conditions that have cropped up in your family recently? Okay. So somebody's just had type 1 diabetes diagnosis. Okay, thank you for letting me know that. In what relation are they to you? Right, so that's all the questions I have for now. So I'm going to just begin. By popping on a pair of gloves here. Okay, so we are going to simply begin by checking our patient's chest breathing. Okay, right, ask you to listen to the same, okay? I'm going to be taking my stethoscope now, and we're going to be first asking the patient to please lift your top up for me. Okay. And then we are just going to simply listen to the patient's lungs, okay? So, I'm just going to ask you to start by breathing normally for me. Good. What I'm listening out here for is any sort of rattling or excessive kind of dull, almost like if you imagine wind rattling on a window. If I can hear any air escaping. Okay, and then could you breathe? Deep breath in for me. And out. Okay, and then again, deep breath in. And out. Very good. Okay, if you don't mind, I'm just going to ask my student assistant. She'll just also have a little listen in so that you can see what I'm hearing right now, okay? Hi, lovely to meet you. So, I'm just going to again listen to your breathing, okay? So, if you could again lift your top up for me. Okay, just start by breathing normally. Okay, just take a deep breath in and then out. And could you do another one for me? You hear it? Good. Okay. Thank you. Okay. Okay, so next we're going to be checking their eyesight. So I want to leave this to you. I'm just going to nip out to the room. You're in perfectly safe hands. I'm just going to ask you to check their pupil dilation with the light. So pupil dilation, peripheral vision. And then follow the finger. Okay. Your eyes fine. I'll be back in just a moment. Okay. So me again. So now we're going to do the eye examination portion of today's assessment. So as Dr. Michelle wants us to basically do an overall testing, especially she mentioned dizziness. So today I'm going to be looking out for any lagging of your eyesight, because that will kind of indicate maybe why you're feeling a little bit almost like swaying, dizziness, not being able to focus and concentrate, especially when you make sudden movements like getting up. Okay, so I'm going to start with the torch. So what I'm going to ask you to do is for you to just stare behind me or at my nose or whatever you want, but don't look directly at the light. I'm just going to get a little bit close to you. shining the light in between your eyes to watch your pupil dilation, okay? Okay, great. Good. Let me know if any time you want me to stop. I know that it can be quite straining on the eyes. Good, you're doing really well. Okay, and the other eye. Okay, that seems really great. If you don't mind, I'm just going to make a note for my memory. So, pupil dilation, great responses. Okay. Have you had any recent eye tests? You have, and did they all come back fine? Yeah, okay. This is just routine then. Okay, next I'm going to be testing your peripheral vision. So again, I'm going to be asking you if you could stare at my nose or at the wall behind me. I'm going to take my hands and I'm going to bring my hands into your vision. And all I want you to do is simply to tell me when you can see them, okay? Alright, great. Good. Good. Great. Good. 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 I'll just do it a couple of times. Good. Good. One more. Great. Okay, second peripheral test. Again, staring at my nose. I'm going to hold up 2 fingers on each side and I want you to tell me if it's my right or left that's wiggling without actually looking at them. Alright. Good. 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 Great. Good. Good. Okay. Good. Good. Very good. Okay. You're doing really well. Thank you for being so patient with me. I know I probably take a little bit longer than your usual doctor, but still learning. Okay, then the last test that Dr. Michelle wanted me to do was the follow your finger test. So I'm going to ask you to keep your head very still for me, and I want you to just follow my finger only using your eyes, okay? Good, okay. Good. Going in and out. Good. you're all done? Yeah, no problem. So we didn't have any problems at all. Great. Okay. So now we can move on. We're going to check at your throat, okay? So this is our big sort of issue that you may have been having. So we're going to use two different tools. I'm going to use this little mirror here, which I can use to look at the back sides of the throat, looking for any irregular spotting, any pustules, any sort of strange texture, bleeding. Yeah. Okay. And then also, I'm just going to use the tongue to press it just to help remove the tongue so that we can see. Okay. Wonderful. So, if you don't mind, I'll do this part. Okay. So, if you could stick your tongue out for me and say ah. I'm just going to place this on your tongue here. Okay. And I'm just going to have a look at the back of your throat. Just try and stay nice and wide open for me. Okay. I am seeing a little bit of redness. How long have you been having these problems? Okay. Right. Well, to me it does just look like a little bit of a sore throat. If it's only been for 3 or 4 days, then I think that it is most likely just due to cold-like symptoms. So I'm going to recommend that you take some buttercup syrup at home. Keep topped up on ibuprofen, which will help the inflammation of your throat go down. If you're experiencing any pain, then I would take a paracetamol as well. Okay? Great. So I'm just going to make a note. It's always good to make a note of what you discussed, so that if at any further date you need to prescribe anything, then you know the previous examinations, that you know what results you've been getting. Okay? Great. Okay. So now, if you don't mind, I'm just going to have a little bit of a feel around your neck, okay? Alright, thank you. Now all I'm doing is I'm just gently squeezing and palpating the skin around the neck here. And I'm just feeling for any inflamed, risen lymph nodes. I don't see any. Your neck does feel a little bit swollen though, maybe due to, as you're describing this sore throat, you're not experiencing any other sort of symptoms or anything. No, just the sore throat and the dizziness. Okay, no, that's absolutely fine. And then I'm just going to simply take your blood pressure before you go, just so I can actually see if your headaches and dizziness is due to any sort of blood pressure issues. You may have low blood pressure, which is causing you to feel slightly faint. So I just want to make sure that that's not what we're experiencing here. But beforehand, I'd like, if you don't mind, to just have a little palpate of the patient's neck so that you can feel what the lymph nodes are doing, and you can also kind of sense that inflammation that I've been feeling. Alright? Cool. Yep, just like that. Sorry, I've got cold hands. That's it. So if you're experiencing any sort of raised lymph nodes, you would be feeling them closer to the tops of the ears. should be almost like little hard lumps that you can feel. That's it. Okay. Yeah. Yeah, I can feel it. Thank you. Great, thank you. You're free to just take some notes now. Okay. Alright, we're nearly at the end of the session today. I hope that you've not minded this appointment being kind of 2 hours today. Angelica seems to be really doing well. And it's good actually for you to build up some sort of communication rapport with clients and patients whenever you can. Alright, so we're just going to take your blood pressure before you leave, just so again I can see if you've got low blood pressure, because it may have potentially something to do with your dizziness. Okay? So I'm just going to hook you up to my blood pressure monitor here. We've gone a little bit high tech since our last appointment. So I have this box here. I'm just going to take your blood pressure. I'll demonstrate it for you. Seeing as you've never seen this one before. And here we just have our cloth. I will plug into the monitor, okay? So there's no more manual pumping with these ones, which actually does tend to help us a little bit, because it means that we don't over pump, we don't expand the pressure more than it needs to be, which does actually make you a little bit safer as well. Not that we ever have that problem, but a bit of a peace of mind. Okay. So what we want to do with the cuff is we want to place it onto the patient's non-dominant arm. So are you left or right-handed? You're right-handed, okay. So place this around your left arm. Great, and make sure that the tube right here is facing on top. Okay, you're holding that for me. Good. Okay, I'm just going to plug in the end into the monitor right here. Okay, and then we're just going to simply press start. So let me just unplug that. And then we'll just unstrap that from your arm. There we go. Okay. So that was all normal. So there we have it. So again, I suggest that you just keep trying to take buttercup syrup and ibuprofen for the inflammation of your throat and see how that is for a couple of days. The dizziness, have you ever experienced hay fever? But you have. Okay, so dizziness can actually be a symptom of hay fever. We are at a really high pollen count season at the moment, so that may be a reason for the dizziness. Just continue to keep drinking lots of fluids, making sure that you're eating a really healthy diet, and make sure that you're getting enough sleep as well. It's really important to look after ourselves, and hopefully the dizziness will subside. But again, if you're still persistently feeling these problems after about 5 or 6 days, make sure to come back to us. And also say to the patient that if you don't mind, I'm going to let the receptionist know that I've referred you to have a blood test. This is just going to help us to identify any issues, seeing as you have recently had a close family member be diagnosed with type 1 diabetes. So it's important that we make sure that you are okay and in check. And then every time that we see you, we'll just register for a blood test, maybe every 6 months or so, or if you experience any strong issues that are indicating to us that you may also experience diabetes. Okay, wonderful. So thank you so much for coming in today. I hope that that's helped a little bit. Again, if you're feeling still really unwell, make sure to call up and book another appointment. Thank you so much to Angelica for being such a wonderful assistant. Thank you for having me. And hopefully you'll see Angelica a lot around the clinic the next 2 years you've still got. Alright, thank you so much. Hope you feel better soon.